About mammograms. You're going to hear the word mammogram mentioned a lot in this video because we wanted to sink in just how important having a mammogram is. Did you know that there are many women who do not know what a mammogram is or have never had a mammogram? Well, let's educate. What is a mammogram? A mammogram is an X-ray picture of the breast using a specific type of machine. Doctors use a mammogram to look for early signs of breast cancer. The sooner breast cancer is detected, the sooner it can be treated with a higher chance of survival. Doctors recommend regular mammograms, which helps to find breast cancer early, sometimes up to 3 years before it can be felt. Don't take having a mammogram lightly, even if you don't feel a lump. I remember doing routine mammograms and it was always negative. So I thought, what's the point in going? Why am I wasting time and money and there's nothing there? I stopped going for a mammogram for 2 years in a row. And what happened? I felt a lump. At first I was in denial and tried to convince myself it was just a muscle. I went to my doctor for my regular annual checkup and my doctor felt the lump too and started asking me questions. One of the questions was, have I felt it? My answer was yes, but I assumed it was a muscle. I didn't want to believe differently. She referred me for a mammogram, and with the concern, of course, I went. It is important to get routine mammograms even if you don't feel anything. If you feel a lump, make a doctor appointment immediately. Don't wait till your annual checkup. I felt the lump almost a year before my annual appointment. If I had went ahead and made my appointment to see what the lump was, things might have turned out differently. How is a mammogram done? You will be asked to put on a gown that opens in the front. You will stand in front of the mammogram machine. A technologist will place your breast on a plastic plate and another plate will press firmly on your breast. The plate will keep your breast still while the X-ray is being taken. You will feel some pressure and discomfort at first, but it doesn't last long. The steps are repeated for both breasts. Each woman's mammogram may look different because, as we all know, they come in different sizes. What happens next? A doctor with special training, called a radiologist, will read the mammogram. He or she will look at the X-ray for early signs of breast cancer or other problems. In most cases, they will notify your primary doctor with the results. When will I get the results of my mammogram? You will usually get the results within a few weeks, depending on the facility. Try not to focus too much on the results. This will only bring you stress. A radiologist reads your mammogram and then reports the results to you or your doctor, but most likely your doctor. If there is a concern, you may get the results sooner. Contact your healthcare provider or the mammogram facility if you do not receive a report of your results within 30 days. If your mammogram comes back normal, congratulations! There is no cancer. That's what we're rooting for. Continue to get your mammograms, not for something to be there, but to make sure that there isn't. If your mammogram comes back abnormal, it does not necessarily mean it's cancer. Follow up with your doctor to proceed with the next steps. If you have questions or concerns, there are several cancer institutes that you can contact. There is also more support. Remember, you are not alone, with or without breast cancer. There are many support groups. I Care With You Breast Cancer Awareness Organization is here for you. We are praying for you and rooting for you to be cancer-free and to be a breast cancer survivor. Now, let's take a moment of silence for all the women who have lost their battle with breast cancer. Thank you. For more information on I Care With You Breast Cancer Awareness Organization or to make a donation, visit kbutterfly.org.